Well, welcome everyone to this session 6 already of Navigating Special Needs Family Training. We're happy to have you here today. There's a welcome sign in whatever language you might speak. Just a little Zoom logistics again. If you want to keep your microphone muted while you're talking, we love to have your videos on so we can talk to real people. If you have questions for the speaker, please type them into the chat for everyone and I'll watch those and gather questions for the discussion period. And for that discussion period, we just remind you to share the air, to keep confidentiality, to speak from your own experience, and also we don't advise other people unless people are directly asking us for advice. But we receive and respect what people share. If there is something that's off the part of this topic, but you'd like to have it addressed, please just mention this is a parking lot item in the chat, and we'd be happy to look at that later with you. Okay. I'd encourage you to rename yourself so we can see your name. Rachel does keep attendance, so we can keep good records. In the upper right-hand corner of your video square, there's 3 little dots. And if you click on that, you could see a thing to rename yourself. Or at the top, you can click on More and rename yourself. And so while everyone's gathering, I'd like to just encourage you to type into the chat box, what's the best thing about returning to school at your house? And some of you may not have returned to school yet, but routine, yes. Grandchildren's first days of school and photos, yep. And your teenager not being bored all the time. Yeah, Amira, what is the best thing about going to school, though, when you do go? I know Cedar Rapids has delayed their start a little bit where Amira lives. Having some time to yourself. Yes, I would think. New school supplies was always my favorite. I loved school supplies and sharpening pencils and the pencil boxes and the first day of school. Clean your house is cleaner when you get home and seeing the kids so happy. Yeah. Anyone else just joining us and want to type in what's the best thing about returning to school at your house? Whatever that looks like for you this year. Okay. I'd like to invite you to participate in this poll to start out, answering questions about your knowledge of financial resources for children and youth with special healthcare needs. And this is not to shame anyone. We're just curious about what you already are familiar with. So there are 6 questions. I hope I have it set up so that you can click as many as apply. So maybe it'll let you do that, maybe it won't, but go ahead and try. Does it let you select more than one?
Yes, it is.
Okay, good. Thanks, Angie. I was hoping it would. We have a couple more to vote. Welcome to those who just joined us. We're hoping that you can see this poll to indicate your awareness of the financial resources available to children and youth with special healthcare needs. So if you can give you a few more seconds here. Okay. And now I'll share the results with you. As you can see, we are very familiar with Medicaid. And a couple of us have yet to learn more about it. We have some waivers and we have some people on waiver waiting lists. And it's new to some of us. SSI is very familiar. New to some of us, good. Children at home is familiar. One of us has received assistance, and it's new to some of us. So that's, and some of us have just heard of it. Medicaid for kids with special needs. We're all across the board there, aren't we? Now that gold or orange band must be the one that's the highest rating. And the HIP program is pretty new to people. So you have come to the right place, and I'm happy to introduce our speaker today to share with us about this. Lynn Park is a registered nurse with Child Health Specialty Clinic. She received her Bachelor of Nursing degree from the University of Iowa. She currently serves as the program coordinator for the Health and Disease Management Division and the Health Services Coordinator for the Spencer Child Health Specialty Clinic Regional Center. Lynn has been a nurse for 26 years, and the last 19 of those are with Child Health Specialty Clinics. So she's been around, and we're fortunate for that. Lynn has had many roles within the organization, but has always provided care coordination to individuals applying for or enrolled with the Health and Disability Waiver. That's one of the waivers. Lynn is married to Scott, and they have 2 daughters, Emily, 23, and Taylor, 21. So welcome, Lynn. I will stop sharing so you can.
Thank you. Oopsie. Love technology. Okay. Can you see my slides okay? Can you see my slides okay? Can you hear me?
Yes, I'm sorry. I couldn't find my unmute button.
Okay.
Yes, we can hear you and see your slides. Thank you.
Okay. Whoops. All right. So I'm going to stop my video because I have to look at a different screen. So it looks kind of funny when I look away. So thank you, Diane, for that. Like Diane said, I have had I've been with Child Special Clinic for 19 years, and I've had different roles within the organization, but I have always done care coordination specifically for the Health and Disability Waiver. And I will touch on all the waivers, but that is the one that I'm most familiar with because I work with families with that. So, and like she said, please don't hesitate to pop a question into the chat as I go along. I like to keep these very informal, and my goal is not to overwhelm you. I'm glad that most of you have a good knowledge base of everything I'm going to talk about, so this should be pretty easy. But like I said, don't hesitate to stop, throw a question in there, and Diane, feel free to stop me, and I will be happy to answer any questions as we go along. So I'm going to talk just to give an overview of the Iowa Waiver Program. So Iowa was the first state to adopt the Waiver Program. Some of you may have heard of it as the Katie Beckett Waiver. Katie was born in 1978, and about 4 months after her birth, she contracted encephalitis, which left her partially paralyzed. She was unable to swallow. She really had a lot of difficulty breathing as well. And she spent several weeks to months in the hospital. And her parents, really wanted to be able to bring her home, but they made too much money to qualify for Medicaid, which would have paid for the services to be able to bring Katie home. And there was no way for them to be able to privately pay for those services. So her mom, Julie Beckett, talked with legislators, did lots of advocating, all the way up, it made it all the way up to President Reagan. And that's how the Katie Beckett waiver came to be. And it allowed Katie to receive Title 19 to get those in-home services that she needed to be able to stay at home with her parents, waive her parents' income so that they could get the services they needed for her. Her mom, Julie, was the first family navigator that CHSC hired over 30 years ago. And Katie, I think because of her mom's advocacy and allowing her to be at home and everything her parents did for her, she lived much, much longer than doctors ever anticipated Katie would live. She has since passed away. She did pass away in May of 2012 at the age of 34, but she lived way beyond what she was expected to. So that's a little background of how the waivers came to be. And there are 7 different waivers in the state. The health and disability waiver, the intellectual disability waiver, brain injury, children's mental health, physical disability, AIDS waiver, and elderly waiver. Some of the benefits of the waiver is that it really allows those services so that individuals can stay in their home and community, gives that Medicaid coverage regardless of parents' income. It allows that to be as a secondary insurance, and it gives the usual caregivers a break. In applying for the waiver programs, the application is the same for all the waivers. It can be done online or written. And I do believe Diane is going to give these slides out too, I think, hopefully, so that you have access to some of the websites that I have included on my slides.
Yes, we do send that at the end of each in a PDF form. Yep.
Perfect, good. You would think in this day and age that the online application is the way to go. And some parents do it completed online, and that's fine. It goes through a little bit different process. When I'm working directly with a family and having them apply, I do encourage them to do the written application. And if you guys have this website, you can go right to it and be able to print it and fill it out. It goes through just a little bit different process when it's done online. And I just had some families' application get a little bit mixed up. And so with the written application, you can write on there what you're applying for, whether it's several waivers, the Medicaid for kids with special needs. It's one application for all the different programs. And so with the written, you can write that on there, and it typically does not get missed, which is what we look for. Begin the disability determination process if not already determined disabled. That is for the health and disability waiver only, and I'll talk a little bit more about the disability determination here in a little bit. Complete the form and return to the imaging center. There's 5 different imaging centers across the state where they get returned to, and if you happen to be working, I know especially with anybody within Child Health Specialty Clinic, we have those addresses and we can get those to you. Consumers can be on more than one waiver waiting list at a time. So you can apply for more than one waiver that might be a fit for your child or your family member, but you can only actively utilize one waiver at a time. So you can apply for 3 or 4 of them, but then what decision will have to be made as to which waiver you want to utilize that's going to best meet the needs for your child and what your family needs. When you go to apply for the waiver programs, if your child is already eligible for Medicaid, then you just need to do a 1-page application as well. So it's a lot. The written one is about 24 pages. So if they're already Medicaid eligible, they just have to do a 1-page. So disability determination, I think this can be the most confusing part in the whole application process. Like I said, for the health and disability waiver, and that's the only waiver that they have to be determined disabled in order to get onto the waiting list for that particular waiver. So you can begin that disability determination process prior to the submission of the application to DHS or the Department of Human Services, or you can do it at the same time as the application is submitted. It's not a thing that has to be done before you apply. You can do it simultaneously. So you need to start by calling your local Social Security Administration office. You just let them know that you're applying for the waiver program for your child and you need to start a disability determination. They'll probably set up a phone interview with you. Most of the time, these are just done over the phone because the only thing that the Social Security office is going to look at is your income. They're just going to look at income eligibility. So if your family falls within the income guidelines for Social Security income that your child may qualify for that, then the Social Security Administration office will proceed with the disability determination. When they're looking at that income, if you're over income for your child to receive SSI, then DHS will do the disability determination. And they'll tell you that right away on the phone. That's what they'll gather is your income. They'll look at it, they'll say you're over income, and they'll just stop and they'll mail you a letter that says you're over income. What happens is when you have submitted that application to DHS, then once they contact you, I tell families to keep a copy of the letter from Social Security Administration if you're over income, to keep a copy of that, because sometimes DHS will want to see that. But they're going to then mail out to you a disability packet. And it's a disability report for children that has to be completed and sent back to DHS. It's another very lengthy form. It's, again, about 25, 26 pages in length. And it's going to ask you all sorts of questions about, does your child have an IEP, if they're involved with AEA, where they've been seen as far as medical hospitalizations, any testing they've had done, if they've had MRIs, lab work, anything like that. It goes through it. It's pretty lengthy, but it will go through all of that. Anything that comes from DHS, especially the disability report for children, this is where I find kind of things get stuck for families, is that paperwork is time sensitive. And if you don't get it returned back in time to DHS, they just cancel the waiver application. And they don't call to tell families that. So I do get notified of that if the child is not enrolled with an MCO already, I will get notified of that. And so I like to call families just to say, do you still have that paperwork? Can we get that in if you want to proceed? So I always like to tell families that anything that comes from DHS in the mail, try not to set that aside, because that always is time sensitive from DHS. So as soon as you get stuff from DHS, if you can fill it out and get it back to them, that's always the best option. I can't see the chat, so if there's a chat, Diane, you want to just stop me if there's a question?
We're all good.
Okay, all right. So the waiver waiting list. So like I said before, you have to be determined disabled in order to be placed onto the waiting list for the health and disability waiver. That's the only waiver. The other ones is when you apply and they process your application, whether it's the intellectual disability, the brain injury, children's mental health, that they will go right onto the waiting list. Currently, the waiting list for the health and disability waiver is about 2 years to 2.5 years. The brain injury waiver and the intellectual disability waiver are 3 to 3.5. And the children's mental health waiver is about 1 year to 1.5 years. I specifically talk about those because as you, Child Health Specialty Clinic is birth to 21 for the waiver. So I don't do anything with the elderly, and I've never had to work with the AIDS waiver. So I've created this little bit of chart, and like I said, I'm glad Diane's sending these out because then you guys will have this. And I think she also was sending out this form to you anyway, where I took my information from. But across the board, we'll just kind of see the different services that you are able to get with the different waivers. So the behavioral programming, obviously just the brain injury. Consumer choices option, that is available on all of them except the children's mental health waiver. That families really, really like this service. Consumer choices option is fairly new to the waiver program. It's 3 or 4 years old. And it just allows the families to have a little bit more control over the waiver money that they have for services. When you choose to do consumer choices option, you would work with a support broker from your area, and a support broker is someone who's specifically trained in this service. It does require additional paperwork once you get onto the waiver and want to utilize this service. It does provide a little extra paperwork, but families love this because you can hire your own family members, your friends, neighbors, whoever you might want to provide for the services. It also gives you just a little bit control over and an option to save the money. I had a family one time who they needed a special AFO for their child. Medicaid and insurance didn't cover it. And so they worked with their support broker, and they did like a savings, and they saved that money. And at the end of the year, they were able to purchase the AFO with that money. I'm not even going to pretend to be an expert in CCO because the support brokers are. And most of the time, if I have a question, I'll ask one of them. But I do know I have yet to have a family who used that service that does not absolutely really love that service. CDAC, Consumer Directed Attendant Care. You can see which waivers that is available for. That provides, so the consumer really has to be able to direct their care. So this is typically for older individuals that are utilizing waiver services, and you can hire someone to come in and do your laundry or grocery shopping or do some personal cares that you typically could do, but because of your disability, you're not able to do those. And I think the key thing here is we have to remember they have to be able to direct their care. So young children, we don't really use this service a whole lot for, just because, you know, 5-year-olds, 3-year-olds, they're not really directing their own care yet. So that really is for older individuals. Counseling, that is available on the health and disability waiver. And counseling, that extends out to family and siblings. So that's not just for the individual that's receiving the waiver services, because a lot of times their Medicaid will cover that. So that does extend to siblings or parents. DayHab is from the ID waiver. Personal emergency response, or lifeline, is another term for that, and you can see which way. That's pretty self-explanatory again. Those young adults who want some more independence but need to be able to reach out if they have trouble, we'll use the lifeline for. Adaptive devices is on children's mental health waiver, and the family and community support is on the children's mental health waiver as well. Home delivered meals, we use that when the health and disability. An example that can be as very self-explanatory, home delivered meals can also be supplement. So if some children need some Pediasure or extra protein, and the Medicaid isn't covering as much as they need, sometimes we can get those supplements through home delivered meals as well. Home health aid and Homemaker are also on the health and disability. And the Homemaker is where you can have somebody come in and do some light homemaking services, dusting, vacuuming, that type of thing. It really has to pertain to the consumer of the waiver, though. It has to pertain to that child. Any questions or anything in the chat, Diane? I don't want to miss anything.
No, there's just some talk about wait times on each. And I pointed out that there's a place online where you can see the last application each waiver is servicing. Is that right?
That is correct. Yes. Did you share that website with them?
No.
Okay. I can send that to you, Diane.
That'd be great.
You can send it out to the group if you'd like.
That'd be great. That way they won't have to look around. But
yeah.
the thing is, it won't say you have the wait list is now 2.5 years long.
No.
Kind of infer by what date of application they're taking as to how long it will take. And understandably, right? Because they don't know how long it will take to determine a disability.
Right.
Or if they have Medicaid or not. So all they post is the last application date
that is getting spot. Yep. And so you just kind of figure from there. Yep.
And Lynn, this is Martha. I have a quick question.
Yeah.
So we know that in other states, the wait list might be longer or shorter. I have a grandson applying for the waiver in Minnesota, and you know, and the wait it's shorter than 1 or 2 years. So what affects that?
You know, it just depends how much states So the states, all the states have to have this type of waiver program, and they receive so much from the federal government to support these. Then the states themselves have extra dollars to put towards the waiver program. So it really varies on how many individuals are applying and what the amount per, what the cap amount of waiver dollars the state has to expend towards services.
Okay.
One of the things, in helping to try to keep the waiting list down, we've really started to, when applying, really apply for the waivers that your child may qualify for. Instead of saying, oh, apply for them all, and they don't have an intellectual disability, or if they've never had a brain injury, we don't really want to apply and have them on the waiting list for that waiver, because that just extends the length of time. So those are factors: money, how many people are applying, if they've met their cap per slot, kind of affects that.
Okay, thank you. It's an area for advocacy then too, right?
It is, yes.
And education of legislators, so.
Yeah, I worked with a family from North Carolina that moved to Iowa, and they had a waiting list for one of their WIP for like 11 years. So it just really varies across the board. So even though 2 and 3 years sounds very long, there's other states that have a much longer waiting list.
Right.
And then their services may differ too, because you can the states can kind of make that how they do their waiver services too.
Right. Yeah. Thank you.
Yeah.
So Lynn, another question in the chat. What if families applied for waivers, but they can't remember which ones they applied for? How do they look those up or talk with somebody at DHS again?
So I will say, if you're working with somebody within Child and Specialty Clinic, you can ask us because we can usually find that information out for you. You should, and I say should, be able to call your local DHS office and talk with an income maintenance worker. The income maintenance workers across the state can look up any child. So you don't have to specifically have the income maintenance worker that was working with you when your child was put on the waiting list. You can call DHS, ask to talk to an income maintenance worker, and they should be able to look that up for you and tell you that information.
And every county has a DHS office, right?
Yes. They are maybe not open full time, but they should have a DHS office. And if you Google like for your area, it should pull up the one, if you Google, like I'm in Clay County. So if I Google Clay County DHS, it should bring that phone number and address up for you.
And let me just point out, Lynn, because you're not looking at the chat, Angie Palmer has the website at her fingertips where it has the chart about wait lists. And so she put it in the chart for everyone.
Oh, perfect. Okay, I'll scratch that off my list. So.
Yeah.
Okay.
It's a great team.
I'm sorry, I just clicked the link, but it said page not found. So
Oh, okay.
You want to check it again, Angie, and repost it? She's on it.
Okay, awesome. Anything else before I go on? Okay, home and vehicle modification. That is where you can do some modifications to your home or vehicle to make it handicap accessible. For the health and disability waiver, they're eligible for $6,300 a year to do different modifications. Where that changes is on the intellectual disability waiver. That, with the ID waiver, it is $6,300 for the lifetime of that waiver consumer. And that's just because with the health and disability waiver, a lot of times we're doing modifications for bathrooms, a lot of wheelchair accessibility, different modifications for that. In-home family therapy is the children's mental health waiver. IMMT, or interim medical monitoring and treatment, is available on the brain injury, health and disability, and intellectual disability. That is not to be meant to be like extended hours throughout the day. That is, a lot of times that is used with what we call EPSDT, or in-home private duty nursing. So those kids that have a skilled medical need, maybe they have a G2, maybe they have trach, ventilator, oxygen needs, and they have a nurse in the home with them. IMMT can be added on. So let's say they're approved by Medicaid for 8 hours a day. And they need 10 hours to get through while parents are at work and before they can get home to be with that child. Then we can tack on a couple hours of IMMT at the end of that. So it's not meant to be an 8 hour a day service. It's meant to be intermittent and interim. And so it's just a 2 to 4 hour to whatever the family might need if they have a skilled need. And this can be used while you're at work. Nursing, that's pretty self-explanatory if that's needed in additional to any Medicaid services. Nutritional counseling, pre-vocational services are on the ID waiver. Respite, which is probably the main reason families apply for the respite, is available on all 4 of them there. The big rule with respite is you cannot use it while you're at work. If both parents are working, you can't use it. But if one is home and the other parent is at work, different shifts, opposite hours, whatever, then respite can be utilized for the parent that's not working. And supported community living is brain injury and intellectual disability. I wish the health and disability waiver had this service, but it doesn't. Supported community living is where you as parent and your service workers, your targeted case managers, you set goals for your child as far as what you want them to work on for life skills. And instead of somebody coming in and cooking the meals and helping them get dressed and doing the laundry, that type of thing, they actually come in and work with them and teaching them how to do those things. They can take them out into the community and teach them how to shop, that type of thing. And this service can be used while you're at work as well, the SCL. Specialized medical equipment, if there's any medical equipment that the child might need that insurance or Medicaid doesn't cover, with the brain injury waiver, you can get those covered. SCL residential based is with the intellectual disability waiver, and that's just residential placement, whether it's in a waiver home, after they're 18 and maybe that's the goal some parents have, then the ID waiver is the waiver that covers that. Supported employment is brain injury and the ID waiver. And transportation, again, I wish the health and disability waiver had this service as well, but it doesn't, and that's just transportation that the consumer might need. Questions about services? Or any other waiver before I get into different?
Lynn, I put in the email address, in the chat, called Waiver Slot at DHS, and that's been very helpful to me. Anybody can email that and say, hey, where am I in the, who are you servicing now, and what's my application date? That's a very helpful thing. And while I have it up, I'm going to also put the, that's all. Thanks,
Okay.
Lynn.
Is that the email? Are you talking about the email?
Yeah, waiver
Okay.
slot at dhs.state.iowa. Yes, yeah.
Perfect. Yes, that is also a good way to find out too, where you're at on the waiting list. I do want to mention real quick, and I don't have a slide on this, but I did want to mention real quick. I kind of briefly talked about, applying for appropriate waivers. And so just, real quickly, the brain injury waiver, there has to be a documented brain injury that occurred outside of utero. For the intellectual disability waiver, to be placed on the waiting list, you don't have to have the IQ testing done yet, but when the slot becomes available, in order to be approved or to, be able to access that waiver, a full-scale IQ test will have to be done by a psychologist before that child can get placed onto the waiver. The children's mental health waiver, they do have to have a serious emotional disturbance diagnosis. And I think I always like to touch on this when I do presentations for anyone, is if the child has a diagnosis of autism and that is their only diagnosis, they will not qualify for the children's mental health waiver. It is not considered a serious emotional disturbance diagnosis. And so if they have if they have other diagnoses with the autism that does fit that, they may qualify. But if their only diagnosis is autism, they're not going to qualify for children's mental health waiver. With the health and disability waiver, there is not a specific diagnosis that you have to have in order to qualify. And I think that's why they go with the disability determination in order to be placed on the waiting list for that waiver. And so what happens is, in order to determine if you're eligible for that waiver, once your SLAT has become available, a health assessment is done either by your managed care organization or another entity that the state contracts with. And they, right now, they're doing them obviously Zoom or over the phone because we're not going into homes. Typically, that person will meet with the family in the home and meet the child and go through the pretty lengthy health assessment. I've heard families say it takes about an hour and a half. From that, that gets sent to Iowa Medicaid, where it's reviewed by nurses and physicians to see if that child does in fact meet the criteria to meet level of care for the waiver. And then the physical disability, they have to be 18 in order to qualify for that waiver. And I think it's getting better. For the longest time, I would see 4-year-olds be on the waiting list for the physical disability. And it's like, no. You have to be 18 to utilize that. Any questions about that?
Yeah, Lynn and Alicia, you can unmute yourself and ask your question directly, but she said, can you clarify for the brain injury waiver, the child has to have a diagnosis of an injury after birth? That's her question. Alicia, maybe you want to say more.
Hi, this is Alicia. Hopefully you can hear me. I'm kind of multitasking with children remote learning today.
Oh, no, I can
Yes,
hear you
we
fine.
can hear you.
So no, I was just curious. I did not realize that that was part of the brain injury waiver, is that the insult couldn't happen in utero.
Mm-hmm.
Did I hear you correctly?
That is correct. I don't think they have changed that. I had checked the list of the criteria, the diagnosis here from my last presentation, which was probably 9 months ago or so. And that was still the criteria.
Is that something that could have changed over the years, do you think? I'm asking personally because my daughter's on the BI waiver and her insult happened in utero.
It depends on if they have other diagnoses with that. So
Okay.
so that's kind of the key thing there, is if they have other diagnoses with that.
Sure.
I know, like, I've had a child with agenesis of the corpus callosum, which is totally a developmental thing,
Mm-hmm.
get on the brain injury waiver, but they also had a seizure disorder related to an effect that happened while they were hospitalized. So I think it depends on if there's other things.
Well, so probably her diagnosis of cerebral palsy is what helped.
Yeah.
Okay.
And a lot
I
of
was just
times
like, as I'm advising other families, I want to make sure that I know that accurate information.
Yes. And a lot of times what they'll do too is most of the children, like, that maybe have had an insult in utero, or after they're usually having MRIs or CT scans, and they'll collect those to look at those when determining a diagnosis.
Okay. All right. Thank you.
Yes.
That's all that I have right now for waivers, unless somebody else would like to unmute and ask their question. Lynn is a very safe person. There's no dumb question, and she's a good person to ask.
Yes.
And there's also obviously other experts on the call that we can work together to answer our questions.
Yes. And
sorry.
go ahead.
Do you know anything about the federal waivers?
Well, it's a federal program that the states have to abide by. So I always say there were state programs, but the federal government says the states have to have them.
Well, my son was taken off the ID waiver and put on a federal ICF waiver.
Oh, I don't know what that is.
Because I've only been able to find limited amount of information about it, besides the fact that he can go to any ICF in the nation.
Huh.
And
that I'm not familiar with. I can learn from you guys too. This is great.
I'm not sure how he got on there, besides his residential out of state is the only thing I can think of.
Oh, so he was on the ID waiver and he's in a residential outside of the state of Iowa?
Yes, and after a couple of years, they switched him to the federal.
Okay. That must be how then he is able to stay eligible to be in a facility outside of the states, would be my guess. Huh. I'm going to have to learn more about that.
Is there a rank order on which support you should, or which waiver you should take? Like, for example, our kiddo qualifies for the ID waiver and like the health and disability waiver, and we just got put on the ID waiver probably 2 or 3 months ago. But I mean, if we get off, or like if we get eligible for the health and disability, is that better than the ID?
You know, that's always a question I get from families. I'm not sure that there's one waiver that's better than the other. What I like to do is individually talk with those families about what is your greatest need, what is your need, and how will this waiver best meet your needs as far as which services are available to your child. The other thing I look at too when talking with families, and a lot of times it's, you know, do I stick with the ID and go to the HD waiver, is how old is your child and what are they going to need for services to support them when they turn 18? What is your goal for that child when he or she turns 18? Do you want them to remain at your home? Do you want them to live in maybe a waiver home where they have some independence, yet they have somebody there to help them? They have care 24/7. Those are the things I like to talk with families about. I think it depends, you know, you can talk with your caseworker too about those same things to say, this is what my child needs and is going to need to be successful in the future. What's going to be the best waiver to meet their needs? And I know that's not a straight answer, but that's really how I look at it with families, is talking about this is what's available on each of these waivers. And so what are you going to need now and in the future to meet your needs?
And Megan, Lynn will have her contact information here at the end, and she's very open to having folks talk with her individually about their family situations, right, Lynn?
Yes, absolutely. My email and my phone number will be on the last slide. And I always say that, please don't hesitate to call me or email me with any questions. I am more than happy to talk with parents about that and kind of helping decide where you want to go with which waiver is going to help you, your family, the best. Or even just applying anytime, anytime anybody has questions, please call. I never have a problem with that.
Perfect, thank you.
Okay. Well, I'll talk a little bit about the Children at Home program. It looks like some of you were pretty aware of this and some have utilized it. This used to be available only in about 21 counties in the states. And here in the last few years, they opened it up to all the counties, which was great. And this is a program that individuals less than 22 years of age and meet the definition of developmental disability. So the little bit difference here between this and the waiver is with the waiver, you have to go through a disability determination through Social Security or Disability Bureau in Des Moines. With this, with Children at Home program, if your child doesn't already have a developmental disability through Social Security or Disability Bureau, they simply you can take the application to your primary pediatrician, nurse practitioner. They can sign off saying, yes, this child has a disability, a developmental delay, and that counts for this program. So you don't have to go through that extensive disability determination if you don't have that done. Net taxable income for the family has to be less than $60,000. And it just helps assist families in getting services that will help the child remain in the home that maybe are not being met by other programs. So I do always when I talk to a family who's on the waiting list for the waivers, I talk to them about this program to see if they might be eligible. This is one route that you could possibly get some respite care prior to getting onto the waiver. Purchase of some specialized equipment. I think they've done iPads and things like that. Supplies, assistive technology. And I have their website here, and there is a wealth of information on that website. The application is on there. Things that are approved that you can utilize through the program and things that are not approved through the program. So I encourage you to, if you're interested, to go to that website and check that out as well. And I think, was there some maybe on here that did utilize it? And hopefully you can share in the chat if you have had utilized it and what you've been able to utilize it for.
I think it was one person that said they had. So
okay. Good.
You can.
Oh.
I was just going to say, if you would like to put it in the chat, you could, if you feel like sharing. It could be the person who left us early too, so we're not quite sure.
Okay. Medicaid for kids with special
I will
needs.
say,
Oh, go ahead,
sorry.
Megan.
I will say the one thing about the Children at Home program is if you do have a kiddo in the foster care system and has a disability that you don't qualify for that, you have to go through foster care respite first. And
Oh,
so that was
okay.
one issue that we really struggled with because our kiddo has like 27 medical diagnoses. And so we had to go through the foster care respite, which was really hard for him. And so one piece of advocacy really would be to have kiddos who have diagnoses in the foster care system use the Children at Home program.
Yeah. That is one thing they look at, is if it's not met by other programs. So they kind of utilize it as a last resort type deal. So, but that's good to know. That's good information. Thank you, Megan.
Amira put in the chat that Children at Home will pay for therapy that Medicaid does not pay for.
Awesome. Good. And if there, the other thing too, I would mention to that program is if there's something, you can always call them and ask. If you're looking to see what is approved and what's not approved, and maybe it's not falling in there, I've called and asked them for a family before too. You can call and ask them. And if it's not as a list of something that's approved, I know that you can ask for like an exception and they'll take it to the higher ups to see if they could get it approved. So even if you need something that's maybe not on their list, talk to them and see if there's anything they can do.
Rachel, are you still on the Children at Home board?
I am.
Yeah. So there's another resource within Child Health Specialty Clinics if you want to talk more fully about Children at Home.
The Medicaid for Kids with Special Needs is a Medicaid program that the state, it's about 7 years old in the state. And it was designed for families who have a child with a special health care need and their income is too high to qualify for, I'll say, traditional Medicaid. It's the same coverage as traditional Medicaid, it's just a different way to qualify. They have to be under the age of 19. You do have to have the disability determination done just the same as you would through getting onto the waiting list for the health and disability waiver. Primary insurance. If your employer offers a primary insurance that they pay 50% or more of the premium, you have to enroll that child on that insurance plan. And then the income guidelines, and these are monthly income guidelines. And these monthly income limit is closer to your net, not your gross. And and it's based on how many's in your household. So I just kind of put up there, if you have 5 in your household, then your net income cannot exceed $7,670. And I tell families too, if you're close to that, like if you're over by a little bit, still apply. I'm not by any means an income maintenance worker. I don't know how they do the percentages and all of that. But if you're close, I tell families to apply. The worst they're going to do is tell you, no, you're over income. But I have had families who have said, no, we won't qualify. I'm like, oh, if you're close, just apply. You call me back and then like, hey, we qualified. So I don't know how they all do all their percentages, but if you're close, I would encourage you to apply. There is no waiting list for this program. And some families get confused by this because it's the same application as the waivers. And so you can apply for this at the same time as applying for the waiver program. And there's not a waiting list for this. So it's just a matter of getting the disability determination done and then DHS looking at your income to see if you qualify via the income eligibility. Health insurance premium payment program, that is available to individuals who receive Medicaid and have a private insurance. The state looks to see if it's cost effective for them to pay a portion of your premiums. And if so, then they will pay a portion of your health insurance premiums. And then also then the child becomes excluded from the MCO program with HIP. And they're under the fee for service. So it kind of goes back to DHS managing the Medicaid rather than an MCO. I will tell you, if you have Medicaid for kids with special needs for your child, don't even bother to apply for HIP. You will not qualify for HIP if the child is eligible through Medicaid, through the Medicaid for kids with special needs. I have both their phone number and the website because you can actually just call HIP and they'll do the application with you over the phone if you want, or you can do it off the website here as well. And there is my contact information. Anything, questions or anything else that you would like me to touch on that maybe I didn't touch on?
Alicia says HIP is the best thing ever. You want to talk about it a little bit, Alicia, and what it's done
Sure.
to your family?
Well, sure. I just feel like it's maybe underutilized. I feel like there's a lot of families that don't know about it. In fact, we were under traditional Medicaid until another family that we had met up with at the hospital told us about it. And I just think for families, again, I think it's important to note that you have to have, a primary insurance, but it's just been a lifesaver for us. So everything runs through our primary insurance first, and then HIP covers the Medicaid through HIP covers the other services for Sophia, and we don't have to deal with an MCO.
I had a question. This is Shannon Grunmeyer. I
Sure.
wondered if you could just share a little bit about the differences between an ID waiver versus the Medicaid for kids with special needs, and what services are covered and not covered between
Yeah.
the two different things.
That's a great. So the Medicaid for kids with special needs is not a waiver. That is simply just Medicaid coverage. So again, it is for those that their income's too high for traditional Medicaid, but it's the same coverage. So it's going to cover what your primary insurance maybe doesn't cover. It might cover some of your copays, maybe some medications that your primary insurance doesn't. A lot of families that their child might need physical, speech, OT, that type of thing, primary insurances only cover so many visits per year most of the time, and it's very limited. And so again, the Medicaid will usually pick those up. Lots of times kids can get it one time a week, even the therapy, or twice a week, and Medicaid will cover as long as that child's showing progress. So Medicaid for kids with special needs isn't a waiver. There's no waiting list for it. It is simply Medicaid coverage for your child that would act as a secondary to your primary insurance. Does that help clarify?
It does. We have it, and I'm very grateful for it. While we wait forever on the waiting list,
Yes.
it has been helpful, as you said, to cover some of that additional therapy. And he's also now eligible to utilize a child serve day health room,
Yes.
which has been really, really helpful. It's not exactly the same as respite, but it's similar for me at least. And so it's really a nice option that we wouldn't otherwise not have been eligible for.
Yes. That program at Child Serve is wonderful.
Lynn, I have a question.
Yeah.
It was my understanding that, so if you're on Medicaid for kids with special needs, but then you get placed on a waiver and go under that Medicaid program, that then you could utilize HIP again. Is that true?
That is true. So yes, if they have Medicaid for kids with special needs while they're on the waiting list, and then they get approved for the waiver and they have Medicaid now because they are on a waiver, they can then apply for HIP again because they can get approved once you're on the waiver. So Shannon, remember that when you do get on the waiver, you can apply for HIP.
Thank you.
Yes,
And Lynn,
thank you, Rachel. I usually talk about that, and I'm glad you brought that up.
Sarah has a question. If her son is being tested for autism, which should she apply for?
Well, the health and disability waiver for sure. Again, they have to have an intellectual disability in order to qualify for the ID waiver. And, many children with autism don't have an intellectual disability, and they're not going to qualify for the children's mental health waiver. So, that's kind of, again, you can always call and talk with me, Sarah. We can talk about that because for sure the health and disability waiver is going to be the most broad one that's going to cover that.
Well, thank you, Lynn. You are indeed a state treasure.
Oh,
We really
you're too kind.
appreciate all that you do for us, and we know you're so open to helping anybody, family navigators and families across the state with our questions. There are a lot of things and ins and outs to this programs, and I think sometimes it probably makes sense from a state agency perspective, but from a family perspective, it's like, who's calling me? What form do they need? Why do they need it? And when you're in the throes of caring for children with special healthcare needs, it can be particularly tough. Maybe you don't have enough sleep, or something traumatic has just happened, and then the forms come in the mail. So don't ever hesitate to reach out. And if you can only remember any one of our names or emails, we'll get you to Lynn too. So
Yes. And I'm always happy to answer questions anytime.
thanks, Lynn.
All right. I'm going to leave you.
Okay.
Bye-bye.
Thanks again, Lynn.
Thanks.
I just want to highlight that the next in 2 weeks, we'll have Exploring Care Coordination. Martha Hanley will do that along with a family navigator, Clementine Carl. And this is kind of, we've been very specific. Now we're going to back up in the big picture and say exactly what is this thing called care coordination, and do I have it, and do I need it, and should I be doing it for my child? So you're welcome to share information with your colleagues to apply. Please don't share the Zoom link, particularly because we like people to register. And you can register at chsciowa.org. And I would like you to fill out an evaluation. And this time I tried putting a little, a QR code there for you. So if you have a smartphone, you can grab it and do it quickly on your smartphone. I'm going to, Rachel, you can't grab it from my thing and put it in the chat, can you? No, okay, I'm gonna stop. Yeah, you guys can probably still see it there, and then I can grab it if I'm not in slideshow mode and put it in the Slack chat. Well, thank you everyone for attending. We hope you have a good week. For those of you who are already in school, best wishes. And for those of you who are starting, we'll be thinking about you. Keep in touch, and we'll look forward to seeing you in 2 weeks. Take care, everyone.